Welcome everyone to the Tennessee Department of Health training for the kindergarten immunization compliance assessment. This is a guided walkthrough on how to complete the assessment and submit your results via REDCap.
The Kindergarten Immunizations Compliance Assessment, sometimes referred to as a kindergarten survey or kindergarten assessment, is an annual assessment conducted by the Tennessee Department of Health's Vaccine Preventable Disease and Immunization Program, VPDIP, in collaboration with the Tennessee Department of Education and Tennessee schools. The goal of the assessment is to evaluate the immunization coverage and exemption levels of state-required vaccines among children entering kindergarten in the state of Tennessee. Tennessee takes a census-based approach, meaning that we collect self-reported data from all public and private schools in Tennessee, as required by law.
In mid-November, schools will receive their kindergarten immunization compliance assessment packets. These packets will contain all the materials necessary to complete and submit the survey. Public school district contacts will distribute packets to individual schools. From mid-November to the second Friday in January, schools will work to assess student immunization records and submit aggregate results via REDCap. TDH VPDIP will send out regular email reminders to provide status updates and remind contacts of the January deadline. From mid-January to mid-February, school immunization staff will work with school submissions to resolve potential data reporting errors. In March, VPDIP, DOE, and TAIS will work with CDC selected schools to complete audits and ensure data accuracy. From April to May, VPDIP will work to finalize and publish annual reports. In October, shared data will be published by the CDC on the School VaxView website.
The process to complete the annual assessment is different for public than private schools. For public schools, the Department of Education provides us with a file of enrolled children in early October for the current school year. This file includes each child's name, school ID, and other demographic information to help identify the child. We import the district and school information into Tennis, along with the DOE student file to match up students to schools in the IIS. If a student has vaccinations in Tennis, we will be able to match that student with their vaccinations and their school and district information. This is an essential step that allows us to see which children have immunizations in Tennis, and we then generate school reports for every public school district in the state. The reports identify which students are fully immunized and which students need their official immunization certificates checked as part of the assessment. This year, public school districts can elect to receive digital school packets instead of or in addition to paper packets. For private schools, unlike public schools, the Department of Education does not have a list of kids enrolled in each private school that they can share with us. So we need to have a list of private school kindergarten students that we can run through Tennis to identify immunization compliance assessment. Because of this, we are unable to generate a pre-populated report for each private school. Instead, we get a list of all accredited private schools in Tennessee and email each school point of contact a blank kindergarten immunization status report and school summary report to complete. REDCap is a secure web platform for building and managing online databases and surveys. Sendit is a secure data transfer application that allows us to upload a file and then allow multiple recipients to download the file in a secure manner. Each public school department point of contact will receive an email containing a unique download URL, along with a second follow-up email with the password for downloading the file. The file will be stored securely for about a month or 14 days, and then later removed from the server. The first email with a URL will specifically have an expiration date of the link. School district point of contacts are responsible for distributing packets to each school. TDH will not distribute packets directly to the schools. If your school district elected paper school packets this year, the process will be the same as last year. In your school packet, both public and private schools should receive a pack of instructions. These are a step-by-step guide on how to complete the kindergarten immunization status report. They also include a blank school data worksheet, if applicable, the school summary report, and where to report the aggregate results. Refer to the instructions, especially if it is your first year completing the assessment. The instructions will go over a step-by-step how to complete. The next item on the list is the kindergarten immunization status report, and for public schools, the blank school data worksheet. Private schools will not receive this. We will start with the public schools kindergarten immunization service status report. Just to note that the district and school names at the top of this report are fictitious, as are the student names in this report. A public school's first step in completing the kindergarten assessment is to verify that each list of enrolled students on the KISR is accurate. As I've already mentioned, Tennessee Department of Health receives a list of all students enrolled in kindergarten from the Department of Education in mid-October. We know that children may have moved around, or occasionally will have a child who's actually pre-K or a first grader who ended up on the kindergarten list inadvertently. You should look at all of the students listed in the report and make sure these students match up exactly with the kindergarten enrollment for your school. Mark out any students who are no longer enrolled in your school at the time you complete the assessment. The first section of the KISR shown on this slide is the number of children who meet immunization requirements. It lists children who had all of their required immunizations recorded in tennis. Since these students were complete or fully immunized in tennis, you do not need to review their immunization record or verify that they have all the required vaccines complete for kindergarten entry. No action is necessary for any of these children. If a child on this section of the report is no longer enrolled in your school, just cross out their name and don't include them in any totals or calculations as you complete the assessment. Note that children that are fully immunized in tennis should be listed as 1A on your summary report. We also know that you may have had children join your kindergarten class since mid-October. Any children who are now enrolled in your kindergarten but that were not listed in any section of the pre-printed report can be added to this blank public school data worksheet, and the assessment of their immunization record can be completed on this worksheet. At the end, you'll just add up your numbers from this blank school data worksheet and add them to the end of your tallies on the pre-printed KISR to get the kindergarten totals for the school. After you reviewed the names of all the students on the report and added those not on the report to the blank data worksheet, you will need to complete the next section of the status report that lists students who are enrolled in your kindergarten but whose immunization records were not complete in tennis. This slide shows an example of what this section looks like. It's called Children Requiring Record Review, noted in red right above the names on this slide. Notice the students' names are listed, but instead of tennis validated, the categories are all unchecked. You will need to review the immunization certificate on file with your school for every one of these students to check whether they meet immunization requirements for school entry and mark the appropriate boxes. In the next several slides, we are going to go through each one of these columns so you can see where each child fits in our example. We will be using the public schools KISR to walk through the example, but the category definitions for assessing a student's immunization status will be the same for public and private schools, with the exception of the no longer enrolled and transfer student categories. This next series of slides will be relevant for both public and private schools. This is a close-up look of the first 8 categories of the report. We will need to review the immunization certificates of each of these students and mark off which one of the 8 categories the student falls into. Our first category is meets requirements, or MR, as being fully immunized. Typically, about 95% of the children in the state of Tennessee meet all requirements by having their official immunization certificate on file. In this example, we reviewed the student immunization records and confirmed that the first 3 students are fully immunized. So we mark the box in column 1 for each of them. Note that for public schools, individuals that required a manual review that were fully immunized will be listed as 1B on the school summary report. Column 2 is for children with a missing vaccination record. That simply means that the child does not have an official immunization certificate on file with your school. Student number 6 on our list falls into that category. Column 3, in-state public school transfer, less than 30 days, is rarely used. About 100 children a year fall into this category. These are children who, when you do not do your assessment, have just transferred into your school in the last 2 or 3 weeks, and for whatever reason, their paperwork from their previous school has not yet arrived in your office. This category only applies to public schools. If there are students who do not have paperwork on file because they just arrived in your school, they can be exempted from the assessment, and you would mark this box in column 3 for those students. There is also a blank space next to this box. This is where you can note for yourself the date the student transferred in, just so you can remind yourself that this child didn't have their paperwork record on file at the time of your assessment, and to check and make sure their immunization certificate does come through at a later date. Column 4 is for children no longer enrolled in the school. As mentioned previously, this is a category that you should use for children who for some reason are listed but are actually in pre-K or the first grade and not in kindergarten, or if they've left the school completely. The kindergarten assessment is only interested in the actual number of kindergarten students in your school at the time that you are conducting your record review. This is also a column that only applies to public schools. Column 5 is a child who meets the kindergarten assessment requirement by having a religious exemption on file. The religious exemption is a signed statement from the parent or guardian stating that vaccination conflicts with their religious tenets or practices. If the parent has provided such a statement to the school, they are not required to provide any additional immunization information. For this reason, we do not ask about additional detail for children whose parents have filed a religious exemption. Column 6 is a child who meets immunization requirements with a valid temporary certificate. We've provided space for you to write the date of expiration of the temporary certificate besides this box as well. A valid temporary certificate is a certificate that's been completed so that the child is up to date as they possibly can be according to the published national recommended immunization schedule that comes from the CDC and is available online. They should be as up to date as they can be for their age, and their healthcare provider should mark in section 3, the provider assessment, that the child has a temporary certificate that will expire 1 calendar month after their next dose of vaccine is due. This is commonly used for hepatitis A vaccine because the minimum interval between the two doses of the vaccine is 6 months. So a child coming into kindergarten who hasn't had a hepatitis A vaccine might get one just before kindergarten starts, but they're not able to get their second dose until 6 months later. So that child would have a temporary certificate that will expire 7 months after their first dose of hepatitis A vaccine. That gives them time to go into the doctor's office to get their second dose and provide the school with an updated and complete certificate. As you can see in our example, we have one student with a valid temporary certificate which expires on 12/31. Column 7 is for children who meet immunization requirements with a medical exemption. Only about 1 in 1,000 kindergartners have a valid medical exemption, but they can be very appropriate for a child who has experienced a rare severe allergic reaction to a vaccine, or who may be undergoing cancer treatment and cannot have certain types of vaccines until later. Medical exemptions must be issued by a medical doctor or by a local health department. The medical doctor will indicate which vaccines are exempt. Any vaccines that are not indicated as exempt remain required. So if a child is medically exempt from one vaccine, but they are not exempt from any other vaccines, and you see that the child is not complete for their required vaccines, their vaccine record would be considered incomplete, even though they have a medical exemption. They also have other required vaccines that are incomplete. In other words, medical exemptions are for the vaccine listed only and not a medical exemption from all vaccines or any vaccines that are not explicitly listed as being medically exempt. Category 8 is for incomplete vaccine record. These records do not meet the state immunization requirements. Either the child may be missing the vaccine altogether, or one particular dose may be outside of the immunization schedule issued by the CDC, in which case they would be considered incomplete, or a dose might be considered invalid, making them incomplete. You can see here that we have one student whose vaccine record is incomplete. If a child has a certificate on file that is either a valid temporary certificate, number 6, a certificate with a medical exemption, number 7, or a certificate that's incomplete, number 8, perhaps an expired temporary certificate, we want to know which vaccines the child is complete for, not incomplete for, but complete for. If a student falls into category 6, 7, or 8, you need to check the individual vaccines for which the child is complete in the appropriate boxes under columns 9 through 14 on the report. As you can see here, even though student number 4 and 5 are not fully vaccinated, you can see that each student is complete for at least some of the required vaccines. The reason we ask this is because we report our numbers to the CDC. We report the number of children across the state who are fully immunized against each of the individual vaccines. So again, please mark the complete vaccines, not the vaccines that are missing.
In accordance with Public Chapter 169, Senate Bill number 386, which allows valid military immunization records to be submitted for school entry. Immunization requirements are the same for these military records, and students should be reported in the category that represents their immunization status. A link is provided for more details.
Once you've completed the assessment of individual records for all the kindergarten students who were enrolled in your school but were not complete in tennis, you will then add up the totals from all of the columns from your KISR sheets. For public schools, the first item you will add up is the number of students who were tennis validated and therefore fully immunized. So you do not have to check their records. In this example, there were 13 students listed as tennis validated on the pre-populated report. And these children were in fact all kindergarten students enrolled in your school. So you will write 13 in number 1A of the school summary report. Next, you'll add up all the column totals in the children requiring record review section and write them in row A, total for each column. Remember to also bring over your column totals from any blank school data worksheet you may have filled out if there were kindergartners enrolled in your school who were not listed in the pre-populated report. These totals will be written into row B, totals from blank worksheets. You will then add up and write the final totals in the A plus B row. And the numbers that go into this bottom line, the A plus B row, are the numbers that will correspond to your school summary report, which we will go over next. This is the KISR for private schools. Step 1 for private schools is to list all students currently enrolled in kindergarten in your school on this sheet. Make as many copies of the blank worksheet as needed. If teachers are completing the report for their classroom, be sure that each classroom has enough copies. A staff member or nurse in your school will then need to review each student's immunization record in order to complete the worksheet. Note that students who are fully immunized do not need to be listed individually in the blank rows and should only be summed in number 3, number of fully immunized. Same as for public schools, you will need to mark the student status in one of the categories in column 4 through 8 for each student who does not meet the requirements as fully immunized. In column 6, 7, or if columns 6, 7, or 8 are marked for the student's vaccine status, valid temporary certificate, medical exemption, incomplete vaccine record, you will need to mark each individual vaccine for which the child is complete in columns 9 through 14. Again, columns 9 through 14 are for the vaccines that are complete, not for the vaccines that are missing. The public and private school status reports have almost identical categories. The only difference is that the private school report does not have a column for in-state public school transfer less than 30 days and does not have a column for no longer enrolled in school. This is because private schools do not get a list of students pre-populated in their reports. They only have blank worksheets to fill out. When you're done reviewing all immunization certificates, please tally the totals for all of your columns across all the KISR sheets that you use to complete the assessment for your school's kindergarten. Finally, you will then complete the school summary report. Looks differ slightly between public and private schools. The school summary report, which has been referenced several times previously, is where you can capture the aggregate totals that you just calculated from all the kindergarten immunization status report and the blank school data worksheet pages. When you are done recording your totals on the school summary report, you will submit the results online using the link provided on the top right corner of this school summary report and also listed in the instructions. A note for private schools. Even if your school only has one kindergarten student enrolled this year, you must complete the kindergarten assessment. If your school has zero kindergarten students enrolled this year, or your school is normally a distance learning program outside of COVID, you can simply go online and indicate on the survey that the school has either zero kindergarten students enrolled this year or your school only has distance learning programs. And of course, will not need to report student aggregate data. Once you have completed your school summary report, you will go to the online survey to enter your results and complete the kindergarten assessment. This survey must be completed by all school, public and private schools. Now that we have discussed how to review and document immunization records of your kindergarten students, the following slides will show screenshots of the public survey, but please keep in mind that the survey sections will be the same for both public and private schools, just slightly different questions as we already discussed. You will first select public school district or county in the case of private schools, and you will then get a drop-down box to select your school name. The school names may not show up in alphabetical order, so please select the box and start typing your school name and the possible response options will pop up. You will then click the next page button. If you ever need to pause completing the survey for any reason, you can always select the Save and Return button. If you select this option, you will be given an auto-generated return code, which will be required to enter upon returning the survey in order to continue where you left off. Please, please, please write this code down or email it to yourself. Without it, you will not be able to return and continue your saved survey. And you will have to start another survey from the beginning, which will create duplicate records on our end. The next section asks for your contact information. This is important for us because we don't receive any paperwork back from you. So if we need to follow up with a question, we will know who to contact. After the contact details, in the next section is the school summary report. You're simply putting those numbers into the online survey from the summary page that you completed previously. You'll notice that the question numbers in the online survey match the question numbers on the school summary report. This is true for both public and private school surveys and their respective school summary report worksheets. The online survey has logic built into to check and make sure it's an appropriate number based on the other responses you provided. This screenshot is an example of what you'll see if you mistype something. For example, in a previous question, we said that only one child was not fully vaccinated. But in number 14, we're saying that 4 children were not fully vaccinated, but were complete for hepatitis A instead of just one. So obviously there is a mismatch. When that happens, you'll see a red box that will show up and highlight what error is present in your survey. When that happens, you can go back and look at your answers to see how it needs to be corrected. Once you correct the error, that box will simply disappear. One note about the immunization compliance assessment completion date. If for whatever reason you are not able to report your results online the same day that you finish aggregating numbers for the school summary report, when you provide the date of immunization compliance assessment and completion, please write that date that you completed the school summary report, not the date that you're filling out the summary. Again, the date that you list here in the middle of the screen should be the date that you completed the review, not the date that you are reporting it to the survey. The next page will give you a summary of your responses that you can review before you submit. If you see anything you want to change, you can always go back by selecting the previous page button to edit your responses in the previous pages. You can then use the next page button to get to this screen again. Once you finish reviewing your answers and everything looks good, you can click the Submit button. Once you submit your survey, you will see this screen thanking you for completing the assessment. If you would like to receive a confirmation email that you have completed the assessment, type in your email in the space provided and select Send Confirmation Email. This is a good way to remind yourself that you already submitted your school's results. Unfortunately, we do not have an automatic way to send the email confirmation to more than one person. So if, for example, you need to notify your school district that you have completed the survey, you will need to forward them the email confirmation that you received. The email will not include a copy of your submitted results, but you can download a copy of your responses by clicking the download button at the bottom of the page. This is suggested so that you can have a record of all your results.
Public and private schools must complete the survey online by the second Friday in January. District point of contacts will receive regular email reminders from mid-December through mid-January indicating schools which have not completed their assessment online. If your school district provides you with special instructions that they want you to complete in addition to what we have went over in this presentation, please follow your school district's special instructions as well. If you ever have any questions or concerns about your submission or you're not sure how to assess a particular child's record, you can always contact us either via email at school.imm@tn.gov or by calling us at 1-800-324-1813 extension 9. And again, thank you for all that you do to support the kindergarten assessment.
I now want to welcome David Barron, who's going to do a technical review of the school immunization records.
This is David Barron with the Tennessee Vaccine Preventable Diseases and Immunization Program. I'm going to review some school immunization requirements and show you some examples of some common issues you may encounter. Children entering the school in Tennessee must be up to date on required immunizations at the time of enrollment. The parent or guardian must provide a valid certificate of immunization to the school. Schools are required to maintain immunization certificates on file for children enrolled at the school, and the parent or guardian may be required to provide an updated certificate as children receive additional vaccines, as would be the case in a child with a temporary certificate. Tennessee immunization requirements follow Centers for Disease Control and Prevention and Advisory Committee on Immunization Practices recommendations. The recommended immunization schedule for children and adolescents and the catch-up immunization schedules are posted at the link below on the CDC's website, and a screenshot is included. This slide compares the vaccines that are required for preschool, pre-K, and kindergarten. For preschool and pre-K, the vaccines Hib and PCV are required, but these vaccines are not required for kindergarten admission. Children entering kindergarten are required to receive additional doses of DTaP, polio, hepatitis A, MMR, and varicella. Now I'm going to review Tennessee school immunization requirements and review each required vaccine and the recommended schedule. Tennessee school immunization requirements are posted on the Tennessee Department of Health website, and a link is included on this slide. For hepatitis B, the recommended schedule is a 3-dose series at birth, 1 to 2 months, and 6 to 18 months. Some children may receive 4 doses if they receive hepatitis B vaccine in a combination vaccine. In that case, the extra dose is often disregarded. The minimum interval from dose 1 to dose 2 is 4 weeks. The minimum interval from dose 2 to dose 3 is 8 weeks. And the minimum interval from dose 1 to dose 3 is 16 weeks. The minimum age for the final dose is 6 months or 24 weeks. For diphtheria, tetanus, and pertussis, or DTaP vaccine, the recommended schedule is a 5-dose series at 2 months, 4 months, 6 months, 15 to 18 months, and 4 to 6 years. Dose 4 may be given as early as 12 months, but is typically given at age 15 to 18 months. 1 dose of DTaP must be on or after the 4th birthday. The minimum interval between the 4th and 5th doses is 6 months. And if the 4th dose was on or after the 4th birthday and 6 months after the previous dose, the 5th dose is not needed. For polio vaccine, or IPV, the recommended schedule is a 4-dose series at 2 months, 4 months, 6 to 18 months, and 4 to 6 years. The final dose must be on or after the 4th birthday and at least 6 months after the previous dose. A 4th dose is not necessary if the 3rd dose was given on or after the 4th birthday and at least 6 months after the previous dose. For measles, mumps, and rubella, or MMR vaccine, the recommended schedule is a 2-dose series at 12 to 15 months and 4 to 6 years. The 2nd dose may be given as early as 4 weeks after the 1st dose. So the 2nd dose doesn't necessarily have to be administered at age 4 to 6 years, although that is the recommended schedule. The minimum age for the 1st dose is 12 months, and doses given up to 4 days before the 1st birthday can be counted. For varicella vaccine, the recommended schedule is a 2-dose series at 12 to 15 months and 4 to 6 years. The minimum age for the 1st dose is 12 months. Doses given up to 4 days before the 1st birthday can be counted. Different live virus vaccines, such as MMR, varicella, or intranasal influenza vaccine, or FluMist, not administered on the same day must be separated by 28 days. For hepatitis A vaccine, the recommended schedule is a 2-dose series separated by 6 to 18 months between the 1st and 2nd birthdays. The minimum age for dose 1 is 12 months. 2 doses of hepatitis A vaccine are required for kindergarten admission. However, children enrolling in grades other than kindergarten are not required to have hepatitis A vaccine. This slide lists some common errors that we find with immunization certificates. For hepatitis B, we often see that the minimum age for the final dose, which is 6 months or 24 weeks, is not met. And we also sometimes find minimum intervals between dose 1 and dose 2, dose 2, dose 3, or dose 1 and dose 3 are not met. For DTaP, the most common error we find is that the final dose, either the 4th or 5th dose, is administered before the 4th birthday. In that case, an additional dose of DTaP is required. We also find sometimes that minimum intervals between doses are not met, especially between dose 3 and dose 4, and between dose 4 and dose 5. For polio, the most common error we find is that the final dose was administered before the 4th birthday, in which case the child would need an additional dose of polio vaccine. For MMR and varicella, we find that sometimes doses are administered on different days and at less than 28 days after another live virus vaccine. In that case, the 2nd vaccine that was administered is invalid. We also sometimes encounter dose 1 being administered more than 4 days before the first birthday. For hepatitis A, the most common error we find is that dose 1 is administered more than 4 days before the first birthday, or that dose 2 was administered less than 6 months after dose 1. Now I'm going to review some examples of some immunization certificates that you may see and explain how you would interpret those certificates. The first example is a tennis validated certificate of immunization. These certificates are generated by the Tennessee Immunization Information System, TENIS, and TENIS has evaluated these records using the Immunization Certificate Validation Tool, or ICVT. The ICVT evaluates all doses for minimum age and interval between doses. If all minimum ages and intervals are met for the appropriate age or grade, a validated certificate can be produced. Certificates that are validated by TENIS, which include the statement validated by the Tennessee State Immunization Information System, do not require the signature of a healthcare provider. Invalid doses are not included on the certificate when it's generated from TENIS. So these certificates can be accepted as complete and meets requirements. The next certificate example is one that has been validated by a healthcare provider. Providers are responsible for ensuring that all minimum ages and intervals are met. Providers may sometimes include invalid doses on these certificates, so it's important for the school to review the record to ensure that all minimum ages and intervals are met. Providers may also handwrite dates on these certificates, which is acceptable. In order for the certificate to be valid, the provider must mark the provider assessment box, and they must include their facility name, address, signature, and date in section 4. If the certificate meets all minimum ages and intervals, the certificate can be accepted as valid and the student meets requirements. The next example is a TENIS validated temporary certificate. So in this example, we have a student who received their first dose of hepatitis A vaccine on November 16th, 2021. The minimum interval between hepatitis A doses is 6 months. So in this example, the student cannot receive their second dose of hepatitis A vaccine until May 16th of 2022. TENIS will evaluate this record and produce a temporary certificate that is valid and expires 1 month after the next dose is due. Temporary certificates are only valid if the student is as up to date as possible, meaning they've received all possible required doses on the date that the certificate is issued. Temporary certificates cannot be used for alternate vaccine schedules, and they cannot be accepted for a student who does not meet requirements but may have an appointment scheduled. The student must be as up to date as possible in order for a temporary certificate to be accepted. This is an example of an incomplete vaccine record. Although the provider has marked the certificate as complete, closer review shows that the student is not complete. So in this example, the student's birth date is January 1st of 2016. They're currently 5 years old. The student has the required number of doses for all vaccines because the 4th dose of DTaP was administered after the 4th birthday. However, this certificate does not meet requirements for hepatitis B. If you look at the dates for hepatitis B, the first dose was administered at birth on January 1st of 2016. The second dose was administered at 2 months. The third dose was administered at 4 months. This student never received a dose of hepatitis B vaccine at 6 months or 24 weeks of age. So an additional dose of hepatitis B vaccine is required. Now I'd like to review some special situations, which we'll go into more detail on the following slides. Religious exemption requires a signed statement by the parent or guardian that vaccination conflicts with their religious tenets or practices. Medical exemption must be documented on the certificate of immunization by a physician or public health nurse authorized to indicate specific vaccines are medically exempted because of risk of harm. All other vaccines remain required. The Tennessee Department of Health does not recognize exemption from vaccination for any other reason. In the case of medical exemptions, Tennessee cannot validate certificates for students with medical exemptions. The medical exemptions must be documented on the certificate, and providers are required to indicate specific vaccines that are exempted by marking the medical exemption box in the far right column. All other vaccines remain required. Providers must complete the provider assessment in Section 3 and sign and date the certificate. Medical exemptions may only be signed by a MD, a DO, or a public health nurse in a local health department. The medical reason for the exemption does not need to be provided. Similar to medical exemptions, Tennessee cannot validate certificates for students with religious exemptions. Religious exemption requires a signed statement by the parent or guardian that vaccination conflicts with their religious tenets or practices. The Tennessee Department of Health does not provide a form or affidavit for religious exemptions. If the student needs documentation of a health examination for the school documented on a certificate, and this requirement is set by local policy, the healthcare provider should check the box that the parent has sought a religious exemption to explain why immunization information is absent or complete.
This concludes our walkthrough of the kindergarten immunization compliance assessment. As a reminder, both public and private school kindergarten assessments are due online by the second Friday in January. If you have any questions or concerns, please do not hesitate to contact us via email at school.imm@tn.gov or call us at 1-800-342-1813, extension 9.